Good evening, ladies and gentlemen. This is USMLE Videos. Once again, welcome to our videos at www.usmlevideos.net. Tonight, I would like to talk a few minutes about pilonidal cyst and abscess. This particular topic is very important, so you need to remember a few points about this particular problem. Usually, the question will come like this. A 25-year-old female came to the emergency room. She is complaining about a small abscess which is painful in her back at the lower end of her spine. And what do you suspect in male or female who comes with an abscess around the sacrococcygeal area or perianal area? That is the scenario we usually come across. You should always think about pilonidal abscess in these patients. So let us talk about this particular condition tonight. This is very common, and its incidence is highest in white males. In white males, and also between the ages 15 and 40. Above 50, it is very rare you see this condition. Previously, it was thought that pilonidal disease was a congenital condition that developed along an epithelial tract of the natal cleft. But now it is considered to be an acquired infection of natal cleft hair follicles. These hair follicles, they become distended and obstructed and rupture in the subcutaneous tissue, and they form pilonidal abscess. So this abscess has embryological connection because the hair follicles that form these abscess, they are formed from the natal cleft. Now, clinical findings. Patients will come with pain at the sacrococcygeal region or the perianal region, and you can find small midline pits or abscesses in the midline near the coccyx or sacrum. And this is the patient might be having a lot of hair on his body and perspiring profusely. And you can also see suppuration and multiple mature tracts with hairs producing from the pit-like openings. So basically, these patients, as they walk between the gluteal folds, the hair that grows in that region, it goes into that abscess. So you can also find hair in these abscesses. Now let us talk about complications. Mostly these causes abscesses, and these abscesses might drain and cause soiling of clothing, and necrotizing wound infections and malignant degeneration can also happen, especially if the patient has diabetes. These wounds will last, they stay for a long time. Now let us talk about treatment. Pilonidal abscesses, you can drain the abscess under local anesthesia. Sometimes you can actually give an antibiotic like doxycycline and send the patient to home and observe for the condition. So sometimes there's all the treatment is just taking care of the skin around the abscess and teaching hygiene to the patient to clean up the area and to give an antibiotic that might take care of the abscess. But under certain circumstances, you have to drain it, and meticulous drainage actually heals up pilonidal cyst in many patients, but if it is recurrent, you can always think about excision through surgery. So through excision, midline pits and abscesses should be removed along with the hair from lateral tracts, and open packing and marsupialization, primary closure with or without flaps. So all of these treatment options have been advocated. Finally, a word on prognosis. After surgery, the prognosis is very good. Almost 90% of patients do not get this problem again. But in the remaining patients, some of the tract might still be remaining within the body, and it causes the recurrence of pilonidal cyst. So basically that is the pilonidal cyst. Young patients coming with pain and around the sacrum or coccyx or perianal region with a kind of abscess that has hair follicles in it, always think of pilonidal disease. Thank you. You can always visit our website at www.usmlevideos.net for more videos. In fact, we have posted videos for step 1, step 2, and step 3, and you can listen to our videos free of cost and learn so many most important points for your examination. Thank you. Have a good night.